Congestive heart failure, a guide and tips for patients and family members being discharged from the hospital. Welcome! By the end of this video, you will be able to identify at least 2 causes and symptoms of heart failure, understand the importance of daily weights and fluid monitoring, and be aware of links and resources to help you and your loved one manage heart failure at home. Congestive heart failure is a condition where your heart does not pump blood normally. While there are many causes of heart failure, common causes include heart attacks, leaky or stiff valves, electrical abnormalities in the heartbeat, elevated blood pressure, and diabetes or excessive fluid or salt intake. So you might be wondering, what symptoms does one have when they have heart failure? Heart failure is considered a syndrome, meaning that symptoms and presentations can vary. However, common symptoms include fatigue, weight gain, leg swelling and arm swelling, and difficulty breathing, especially when laying flat. As you are being discharged, you may ask yourself, how can I prevent another admission for this in the future? Are there things I can do at home? Here are some important and effective tips as recommended by the Canadian Heart and Stroke Foundation. Number 1. Take your medications daily. Your medications are important in maintaining your blood pressure, electrolytes, and fluid balance. If you have a habit of missing doses, consider logging them into a medication chart or asking your pharmacy to switch you to a blister pack. Number 2. Monitor your weight daily, checking for any drastic weight changes. While this may be tedious, a rapid weight change can indicate an upcoming exacerbation. If your weight changes by more than 2 kilograms in a week, call your family doctor as they may need to adjust your medications. Number 3. Limit your fluid intake to 1.5 to 2 liters per day. It is important to know that coffee, tea, juice, milk, and soups contribute to this total. Number 4. Aim to reduce your salt intake as much as possible. Here are some tips to do so. Avoid processed foods, deli meats, canned or pickled foods. Season your meals with herbs, spices, and lemon juice to give them flavor rather than salt. Eat more at home where you can easily monitor how much salt goes into your meals. As you may be discharged with new medications, it is important that you speak to your pharmacist or doctor about your new regimen. Make sure you are comfortable taking these medications before heading home. Don't be afraid to ask. Another very important tip is to exercise daily. Daily exercise has shown to improve outcomes in heart failure patients. Exercises can be as simple as walking, stretching, using a low-impact spin bike, or light weight training. The Heart and Stroke Foundation and the Ottawa Heart Institute recommends eating plenty of fruits and vegetables on a daily basis. If you are unsure on how to incorporate this into your diet, ask to speak to a dietitian or consult your family doctor. There is a strong link between sleep, stress, and depression in heart failure. If you are prone to depression or sleep apnea, seek medical attention from your family doctor. By managing these, you will improve your chances of avoiding another hospital stay. So you may ask, where can I go to get more information and resources? Are there online tools or mobile applications I can use? We recommend the Canadian Heart and Stroke Foundation as your go-to resource for more information. Here is the link. Pause the video and click the link to access this website. Other great links include Medication List Chart from the Heart and Stroke Foundation, Daily Weight Chart from the Ottawa Heart Institute, Nutrition Guide from the Ottawa Heart Institute, Tips for Reducing Stress from the Heart and Stroke Foundation. Pause the video now and click the images to access these sites. Other great resources include Medley, a mobile app developed by UHN in Toronto to help patients manage their heart failure at home, Core Health, Mayo Clinic and Cleveland Clinic, and Up to Date for Patients. Pause the video now and click the images to access these sites. Thanks for watching. We hope you have found this video useful. Please take some time to complete an online quiz and provide us some feedback. Thank you.